So hi everybody. Finally the big exam, which is the INI-CET MDS exam for November 2023 is finally over. Today we are sitting here as the first academy in the country to discuss the whole paper, to have an analysis, subject-wise subject analysis of the paper. All right. We have all the 200 questions of the paper compiled with us right now. I was just sitting in my breakout room and discussing all the questions which we have just compiled like this here. I will just show you guys. Okay, so we have like this, we've done a whole analysis of the paper. How was oral surgery, how was prostho, how was patho, how was endo, pedo, and the basic subjects. Everything we have analyzed in the last 1.5 hours. And we are here with you for the exam analysis. I know most of you know the level of competition here. So we at DBMCI are standing with you here to give you the exact details of the exam that has happened 2 hours ago. All right. I am Dr. Himani Joshi. I am the oral and maxillofacial surgery guru from DBMCI MDS, and I'm also the academic director of the MDS division. All right. So overall, if I talk about the exam, it was an easy to moderate exam. Overall, if I have to give you a summary or an abstract of the exam, it was an easy to moderate exam. Definitely not a tough exam. Although it was not a tough exam, but competition will always be the same. Whether it's an easy exam or if it is a difficult exam, the level of competition always remains the same. Easy exam, easy for everybody. Tough exam, tough for everybody. Lot of repeats in this paper. Lot of repeats from the old papers. Lot of repeats from 2013-14, 2011, 2012. Lot of repeats from 2017-18 papers. Lots and lots of repeats. I mean, I can say about oral surgery that almost all the questions of oral surgery, all the topics were repeated previously in the exams. If not directly, then indirectly. So it was a relatively easy paper. And for the first time ever, they have divided the paper into 50 questions of 45 minutes each. I only found the first section to be a little, lengthy. I mean, it really took time for students to finish the first section in 50 minutes. The section 2, 3 and 4 were relatively easy. There were longer questions in the first section. There were more image-based questions, more oral pathology questions, which really needed thinking and really needed reading of the question. So the first section was a little tough, considering the time constraints, considering that you had to do 50 questions in 45 minutes. Most of the students were okay with the timings in the section 2, 3 and 4. So it was relatively okay for the section 2, section 3 and section 4. Section 1 really needed a little, haste. Okay, so coming to the subject by subject analysis. If we talk about anatomy, very, very easy questions. Very, very easy questions in anatomy. Phrenic nerve supplies which, it supplies what? Esophagus, diaphragm, iliac, the ileum or the stomach. Such were the level of questions of anatomy. If you put salt on the anterior two-thirds of the tongue on protrusion, which nerve are you testing? Is it the facial nerve, trigeminal nerve, vagus nerve, the glossopharyngeal nerve? These were the simple questions. Level of bifurcation of the common carotid artery. Place of presence of the, carotid sinus, baroreceptor. These were the easy questions that were asked in anatomy. None of the questions No image-based questions from anatomy. Very easy questions, straightforward questions, direct questions from anatomy. I'm sure most of you have done anatomy correctly. Coming to physiology. Coming to the next subject, which is physiology. There were only 2 questions probably which I can classify, 2 or 3 questions which I can classify into physiology. One was very, very easy. What is the pigment which gives color to bile? And the options are very easy: creatinine, mercaptopurine, and bilirubin. Like, these options were there. So physiology was easy. One question on physiology was on hearing loss. Okay, there was an elderly man who went to a PHC, and the intern is diagnosing him, and he can only listen to shouting voice or amplified voice. So what is the level of hearing loss? So that was probably one question which is not really read by a lot of us. It's really an ENT question, but talking about the basics, it can be classified into physiology. So physiology, one tough question, one easy question. I don't think, even if you've left this question, it is not an issue. Third subject that we talk about is biochemistry. Again, as expected, not many questions were there from the basic subjects. 4 or 5 questions in anatomy, 2 questions of physiology, and 2 questions from biochemistry that students have told me. Worst question was calorific value of fat. Again, it's a repeated question from the older papers. Very, very easy. What is the calorific value of fat? And another question in biochemistry was also relatively easy. It was, I don't remember the question exactly. You will soon have the recall of all the subjects where you will have the paper, but biochemistry was relatively easy. No difficult questions from biochemistry, simple questions. Coming to the fourth non-dental subject, which is patho. Patho was okay. I mean, some questions were direct repeats, like, streptococcus causes adherence to the tooth surface and is a very important organism in causing dental caries. Which property of streptococcus is responsible? That it is, it generates these extracellular polysaccharides, which is the correct answer. This is a repeat NEET question from 2010, 2011, old repeat question. It comes repeated after every 4 and 5 years. So again, this was a direct repeat question that streptococcus has, which property of streptococcus is and also pathomicro. I'm taking pathomicro together here. Another question on fluorescent in situ hybridization was asked. This was not really a direct repeat question, but if you know the basics of pathology, if you have sat for the live classes properly, if you have heard the recorded lectures, if you have read the notes of pathomicro, definitely you must be able to answer the question which was there on fluorescent in situ hybridization. Another pathomicro question was on hepatitis B. That, there was a table where it was given that patient is HBsAg reactive, HBsAb negative non-reactive, and there was HBcIgM reactive. So the serology of hepatitis B in a patient of liver cirrhosis. A patient of liver cirrhosis was given and the serology picture was given. And the diagnosis was asked, whether it's a chronic case, whether it's a carrier, whether it's an immunized patient. Again, basics of pathomicro, basics of medicine, definitely discussed in detail in the classes. Another question was on, reverse transcriptase, reverse transcription and PCR. Like, which of these organisms requires a reverse transcription before you can amplify its DNA by PCR? And there were 4 pathogens which you had to diagnose. So, relatively okay questions. If you have attended your pathomicro lectures properly, 100% you have marked all these answers correctly. There is no doubt that any of these questions will be wrong, because the level of pathomicro teaching we've done, it's absolutely amazing. I'm sure most of DBMCI students have marked pathomicro questions correctly. Coming next to pharma. Pharma questions, again, not very difficult. Pharma questions were very, very repeat questions like, co-prescription of amoxicillin plus clavulinate is what kind of drug interaction? We know it is synergism. Okay, so that was one question. One very odd question, I mean not odd, but question like which plant product used to be smuggled by the East India Company to China when the English invaded our country, which was the plant which was smuggled from India to China. So that was one question which was common in the medical paper, in the MDMS paper, and it was also there in the MDS paper. And the options were like opioids or marijuana, and all those options were there. So this was one common question between the MDS and the MDMS MCH paper. One common question from pharma in both these papers. Then some other questions of pharma which were not very difficult. So pharma was okay. Only 3 or 4 questions from pharma, not very difficult questions. Coming to medicine, you can consider the hepatitis question into medicine. Other than that, there were not many medicine questions. Surprisingly, unlike the last time, there was a question where, it was more of a PhD question. There, 100 chest x-rays are given to 2 examiners. And if the 2 examiners are analyzing these papers, these chest x-rays, and if their p-value is, more than 7.1, then what kind of a correlation is that? So it was a PhD question on chest x-rays. There was not maybe 1 or 2 questions on medicine, but not many questions on medicine. Surgery questions were not directly from surgery. Only one question was there on cricothyroidotomy. And very, very easy question, what is the placement of incision? We all know that the incision is between the thyroid and the cricoid cartilage. It is in the cricothyroid membrane, which lies between the thyroid and the cricoid cartilage. And options are also very simple. Below the thyroid, above the thyroid, below the cricoid, and at the cricoid thyroid isthmus. So very, very easy questions. But we all have taught you anesthesia, general anesthesia, with general surgery. DBMCI is a proud academy to be the only academy which teaches general anesthesia to dental students. And my dear friends, there were 3 to 4 questions directly from general anesthesia this time. Color coding of oxygen cylinder. Then questions like the relative analgesia machine using what concentration of oxygen? Oxygen concentration was asked in the relative analgesia machine. So there were questions from general anesthesia per se from general anesthesia, okay, which is not really a trend. So some difficult questions in general anesthesia, 3 to 4 questions were there from general anesthesia. So this was the paper from the medical side, ANIT, physio, biochem, patho, micropharma, medicine and surgery. Easy questions, few questions. This is the general trend that we see in INI-CET. If we divide it into medical and dental subjects, we always know that the questions from medical subjects are few. This time the questions from medical subjects were very, very few. I think it must be around less than 50 questions from the medical subjects and around 150 questions from the dental subjects broadly. Okay, not exactly. If I talk broadly, these were the partition of questions. Okay, it can be 50 to 60 medical and like 120 to 130, 140 questions from the dental side, which is usually the trend in INI-CET. Okay, always we have more of dental questions. Always we have more of the clinical scenario based questions which are from the dental side. Okay, now we've done the medical section. Now coming to the dental section here. Coming to the dental subjects. DADH, DM, oral path. 3 subjects from the first, second and third year. DADH, there were 2 to 3 or I think up to 5 questions. Very, very easy. Which of these dental structures develops from the mesoderm? Okay. Pulp, dentine, enamel, such questions. Okay. So development of dental tissues. Which of these structures, develops from all the 3 germ layers of the pharyngeal arch? Teratogenic cyst, branchial cyst. So easy questions from DADH. Eruption based questions from DADH. There was a part of an OPG given and very easy question 1-6. Which of these is not a succedaneous teeth? Okay, and the options were like 1-6, 5-4, 5-3 and 8-2. So these were the questions and a radiograph was asked. And which of these is not a succedaneous teeth? And nobody can make mistake in such a question. Very, very easy questions from DADH. Histology based questions, eruption based questions. Most of these were the questions that were asked from DADH. Coming to DM. Good number of questions were asked from dental materials. Many questions. Questions on orthodontic wires, questions on stiffness, questions on elasticity, questions on properties of wires, questions on the different physical properties of materials, like, which of these wires can be bent maximum number of times before it fractures. So many questions on dental materials. They were moderate to difficult. I will not call it very difficult. They were moderate to difficult. So DM was, usually DM is not asked that many a times, but DM was asked this time. Many questions from DM, but they were moderate to difficult. Coming to oral path. Oral path was the most difficult subject. It was the most difficult subject of INI-CET MDS paper. We have seen this trend last time also, that they have started asking histopathology slides these days. Histopathological slides are asked, either a direct diagnosis is asked, or they are giving you the features that are seen in the HPE slide and they are asking you the diagnosis. 4 histopath slides were asked in the exam this time. It was, something like a patient is asymptomatic and he has a growth in the maxilla from canine to first molar. It's an asymptomatic bony exostosis, and on the histopathology you are seeing this. So is it a cementoblastoma or is it a sarcoma? So that kind of questions. One question where they had described the histopath slide, that there is an amyloblastic pattern plus ducts and cords plus whorls are seen and calcified structures are seen. So what is the diagnosis? Is it amyloblastic carcinoma? Is it malignant amyloblastoma? Or is it, chondrosarcoma? So such direct ghost cells were asked. Ghost cell slides were asked. Small round cell tumor was asked with some genetic abnormalities. So HPE slides plus, clinical plus pathological correlation. Such questions are never ever asked many a times in NEET. Such questions are not really taught to us in BDS. I mean, we are never trained to correlate our clinical or the surgical findings or the clinical findings with the histopath image. So everybody who is not taking oral path seriously in their third years or in their internships, please go to your oral path postings. Ask your residents to show you the slides of round cell tumors, of the basic pathologies. Glandular odontogenic cyst was asked, and OKCs are asked these days, and amyloblastoma is asked, round cell tumors are asked, Ewing sarcoma is asked. So these are the oral path questions, and according to me, oral path was the most difficult subject. Most of you who have left the questions, I'm sure most of these questions were from oral path. So that has really made the paper difficult. Otherwise, questions from oral medicine, Again, very, very easy questions from oral medicine. Tricky questions. The questions were tricky, but easy. Like, which of these conditions cause bilateral mandibular swelling? Cherubism. Multiple punched out radiolucencies of the skull. Repeated so many times previously. Multiple myeloma. Philadelphia chromosome. I mean, which of these malignancies has a Philadelphia chromosome genetic abnormality with a Philadelphia chromosome causing the BCR-ABL translocation? Okay, so CML, ALL, AML, these were the options. Very, very repeated question. Male patient with an extra X chromosome. And which of these features will be seen? Whether you will see a taurodontism or a Mulberry molar or a Hutchinson's incisor. Easy questions on oral medicine, but many fact-based questions. Many fact-based questions, but not difficult. If you've done your basics correctly, your oral medicine cannot go wrong. Lot of questions on Nikolsky's sign. Lot of questions on Nikolsky's sign, you know. Which of these conditions will not show a Nikolsky's sign? Pemphigus vulgaris, bullous pemphigoid, cicatricial kensigoid, toxic epidermal necrolysis, scalded skin syndrome. So 3 or 4 questions purely on the Nikolsky's sign. There were clinical image-based questions on Nikolsky's sign. That a patient is having burning sensation on the oral mucosa, and this is how the clinical picture looks like. And in the clinical picture, there was a picture of a patient with the buccal mucosa and a lot of erythema with a thin mucosa, so many ulcerated features, and the options were based on all these pemphigoid and pemphigus kind of deformities. So a lot of questions on Nikolsky's sign, a lot of questions on pemphigus. So that was about oral medicine and radiology. Coming to oral surgery. Every question of oral surgery was a repeat question. Not even a single new question in oral surgery. So all those who have actually listened to the recorded videos properly, attended the live class, attended the test and discussion, attended the doubt sessions, I am sure all your oral surgery questions are correct. Questions were simple, same bilateral TMJ ankylosis, questions on lateral arthroplasty, questions on the transient facial nerve palsy. 3 questions were there on facial nerve palsy. After TMJ ankylosis surgery, there is a transient facial nerve palsy, image-based question. After a surgery, there is a zygomatic nerve palsy, image-based question. After you have given your LA and there is a transient Bell's palsy, where have you injected your LA? Parotid gland. So, easy questions, oral surgery. Questions like, you know, cleft palate, what is the ideal time? Image-based question on cleft palate. What is the ideal time for surgery? 3 months, 6 months, 9 months, 12 months, 18 months. Options were like this. Repeated question. Okay, questions on trauma. 3D plate was asked. It's a neat repeat. NEAT and INI repeat questions. Okay, 3D plate was asked. It is previously asked. Angle fracture, symphysis fracture is asked. You know, the plate which is there, it looks like a ladder. It looks like this kind of a plate, you know. It is this kind of a plate which is there in the angle region. And what is the kind of reconstruction? Is it a recon plate? Is it a dynamic compression plate? Is it IMF or is it 3D plate? So 3D plate was asked. Oral surgery, other questions again from trauma. Distraction osteogenesis, red distractor was asked. Repeat question, again repeat question, cleft palate, orthognathic surgery. 2 questions were asked from orthognathic surgery. So if you are doing your pterygoid disjunction, what should be the angulation of your chisel? Should it be antero-superiorly, posterior-superiorly, antero-inferiorly, which is the answer? Or it should be on the pterygoid process, or it should be perpendicular to the pterygoid plate. So obviously the answer is antero-inferiorly. You always direct your pterygoid chisel antero-inferiorly so that, you know, you can palpate your chisel from the palatal mucosa. So such questions, again questions on BSSO, that the mesial cut which is given horizontally in BSSO, what is the position of that mesial cut? So it is just 2 mm above and 2 mm posterior to the lingula. So such questions on orthognathic surgery, questions on distraction osteogenesis, questions on cleft, questions on trauma, Again, very repeated question. Symphysis fracture causing bigonial flaring. How will you control the width of the mandible? You will control the width of the mandible by controlling the lingual cortex. You will do a bigonial compression. You will compress the lingual cortex and then you will put your plate. So questions on trauma, questions on TMJ. TMJ mein questions were like a patient has rheumatoid arthritis, and because of that he is having a continuous anterior open bite and pain and dysfunction, all of that. So what will be the ideal treatment for this patient? And the option, instead of putting a TMJ replacement, the examiner was very smart and he put the options like a titanium and plastic joint, which is the correct answer because the condylar component is made up of titanium and the glenoid component is made up of a plasticized material. So the answer will be the titanium and plastic joint, which is the correct options. Other options were distraction, CCG, gap, arthroplasty and all of that. So questions on TMJ, questions on LA, questions on exodontia, everything that we cover in our lectures, everything that we have covered in our live class. Easy questions on exodontia. Diabetic patient, you have given a block for the mandibular third molar removal, and after the injection, patient becomes, there is a double vision. There is diplopia in the patient. What can be the most obvious cause? Can it be hyperglycemia, hypoglycemia, or it is syncope, or is it injection into the infraorbital foramen? Obviously, the answer is hypoglycemia. Okay, so every topic of oral surgery was covered. Every topic question was there. Very beautiful questions, but all the questions were repeated. If you have done your repeat questions, if you have done your e-Gurukul question bank properly, I am sure you have marked all the oral surgery answers correctly. Coming to the next subject after oral surgery, we had prostho. Prostho was slightly tough. Lot of image-based questions. Lot of questions on complete dentures, lot of questions on RPD and clasp, few questions on FPD, one question on implant. Very nicely distributed. Whole prostho was distributed. Lot of questions on CD. If there is a bilateral buccal exostosis in the tuberosity region, what will you do? You will remove one tuberosity, you will remove both tuberosities, you will just relieve the tuberosity. Such questions were there. Lot of image-based questions on the Kennedy's classification. Lot of questions on the clasp design, whether you will choose a circumferential clasp, whether you will use an occlusal rest. So a lot of planning-based questions were there in prostho, which is even difficult for a postgraduate to answer. Only if you've done your theory very nicely, you will be able to do. But I'm proud to say that we have covered all these topics in our lectures and videos. So prostho was slightly tough. Endo, again, very few questions, around 5 to 6 questions on endo. IOPA based questions were there and easy questions. These were again easy and repeat questions, just like oral surgery. Open apex, periapical abscess, what will you do? Apexogenesis, apexification, then replacement resorption, internal resorption, external resorption. Questions like the electrical pulp testing, EPT, same image repeated which was there in the previous exam, exactly same image was repeated. EPT question was asked, vital pulp therapy, what is the best way to, isolate your tooth for vital pulp therapy? Rubber dam, cotton roll, saliva ejector, or giving your anticholinergic drugs. So these were the questions in endo. Maybe 5, 6, 7 questions, but very easy repeated questions. Even as an oral surgeon, I found these questions to be easy and repeat. So I'm sure you guys who are thorough with all the subjects, I'm sure you found your endo questions to be easy. Coming to the next subject, which was ortho. Again, very easy questions like Scamon's growth curve. We all know that the somatic tissue or the general growth curve was the arrow, and that was asked. Questions on Herbst appliance. And the options were again very simple, Jasper jumper and Rito appliance, or these forces appliance. Question was on another acrylic tray with a palatal bar, and the options were like activator, bionator, and Frankel appliance and that. I don't really know the answer to that question, but I'm sure Dr. Kunal has covered it very nicely in ortho, and all these appliance-based, image-based questions were asked. Less questions on the techniques, more questions in ortho were image-based questions. Okay. So this was about ortho, not many, which wire can be bent multiple times before it fractures. So such clinical scenario based questions in ortho. Coming to the next, another easy subject, which was perio. Very, very easy questions on perio. Neighbors probe, image based question. WHO probe, image based question. Gingival retraction cord. 2 questions on gingival retraction cord. That what is the chemical used in gingival retraction cord, and which of these is not true. That attached gingiva should be more than 2 mm, and it will cause recession, and it will cause all those complications that are there with gingival retraction cord. So perio questions not very difficult. One question was there on necrotizing ulcerative periodontitis. NUP was there, that which of these is not a feature of NUP, like pocket formation, which according to me is the answer, but I'm not sure. Dr. Divya will have a detailed review on perio and she will tell you the answer. Options were like bone resorption, mobility of the tooth, loss of tooth, and such questions. And one of the options was pocket formation, which according to me is the answer, but I'm not sure. So question on perio, again easy, repeat image based questions. Very, very easy. Coming to the last 2 subjects, Pedodontics and PhD. These are 2 very strong subjects, very big important departments in AIIMS. I mean, every department is equally important, but this time the bulk difficult questions were either from oral paths that we've discussed or from Pedodontics and PhD. PhD questions compared to the May INI-CET were easy. Very, very easy questions from PhD. Definition of range, definition of data, definition of curve of Spee, which is actually a prostho question. Odds ratio, relative risk. Simple questions on PhD. World No Tobacco Day. Easy questions in PhD. Very, very easy questions. Yes, there were some difficult questions, like, the Pitt and Fisher sealant program. That which of these is the most reliable, most, predictable thing which is there done to prevent occlusal caries in children? And I think the answer must be Pitt and Fisher sealant, because that is one program which is going on as a national oral health program in our country. It is, I think the pilot project is already over. So Pitt and Fisher sealant, data, range, curve of Spee. Then questions like, space maintainer is what level of prevention? Okay, space maintainer will be, disease prevention, health promotion. So which level of prevention is space maintainer? So these kind of questions were asked, not very difficult. Honestly, PhD was much more difficult in May INI and relatively easy to moderate in November INI this time. So PhD was fine. The main difficulty came with Pedodontics when questions on myiasis were asked. 3 to 4 questions on oral myiasis, that which country has the maximum patients with oral myiasis, or which condition, like a boy of 3 years of age is not able to concentrate in studies, his developmental milestones are delayed, he plays alone, he's not able to make friends. So what is the diagnosis? Is it ADHD? Is it autism? Is it specific learning disorder? Or is it mental retardation? So such, and plus he has oral myiasis. Which country has the maximum population of oral myiasis? India, Egypt, and such questions. So 3 to 4 questions on oral myiasis, which was the only new topic asked in exam. Every other topic in INI-CET November 2023 was a topic previously discussed in exam, in live class, in recorded class, in PYQs. So every topic is repeated except the pedo topic on oral myiasis. There will be an extensive discussion on oral myiasis by Dr. Anaya when she does her subject review. So I think everything we have covered here, all the subjects, just tell me live, students, just tell me if I'm missing on anything. So all in all, it was not a difficult paper at all. Dental questions, not difficult at all, except for few oral path. And if I have to summarize, the only difficult subjects, oral path, pedo. In pedo also there were easy questions. A mesial step was asked and it will never develop into a class 2, class 3, edge to edge. Which of these will never be found? So pedo questions were also easy. Some questions of pedo were difficult. And prostho. These are the only difficult subjects. Most of the subjects were easy, repeat, simple questions. Even in medicine there were questions like, which chromosomal defect, simple things were asked. HBS, AG, hepatitis, simple questions. So overall, I think DBMCI can boast of a strike rate of around 98 to 99% things which are discussed in our classes. Very few new questions. Most of the questions are repeated. But mind you, most of us make silly mistakes in the repeat questions, in the repeat topics. The only key to success in INI is doing the repeated questions very, very nicely. All those who have done the repeated questions correctly and have left the difficult questions of these subjects, they will be the winners. They will come out to be winners. So this is the exam analysis from me, Dr. Himani Joshi. I hope you've made the most of this analysis. All the new students who are appearing for the exam, just make sure that you take the best from this analysis and, continue with your preparations like this. We are open to questions now. There are some questions that I can see here. Yes, time-dependent killing of antibiotics was a question in pharma. Sunidhi is telling me, why are the questions seeming unfamiliar? I don't know why. Maybe because you're a medical student and you've entered the dental segment. And Aparna is saying that such prestigious institute is asking repeat questions. I don't think that is a problem here, Aparna, because in spite of repeat questions, how many will qualify? Not even 50% students will have a 50 percentile. Not even 50. So if there are 20,000 students who are sitting for this exam, not even 5,000 students will be able to have a 50% score. Easy paper or difficult paper. Remember, competition is always the same. If it is an easy paper, it is actually a disadvantage for the intelligent student, for the hardworking student. It is a slight advantage for the not so hardworking student, but still, the winner will be the one who has done the focused studies, who has done the previous MCQs with the explanation, with understanding of the explanation. So don't worry if it is a repeat paper. It is not everybody's cup of tea to be an AIIMSonian or to be a PGI Chandigarh resident to clear this exam. Only very few of us will come out as winners. I wish all the best to all of you. I hope this analysis has helped you and you can leave your comments. Yes, the answer was 3D plate. It was not recon plate, Mr. Knowledgeism. So there will be a detailed analysis of every subject done by the subject guru. So I wish you all the best and hope you keep your studies going on till NEET. I'll see you. Bye-bye.